Wound Assessment for Nurses Part 1. When you have a patient, you want to start with an assessment, and you will start by assessing this patient's history and present medical condition. So you will do the assessment by reviewing the chart and by asking questions. You ask questions about their health history, and when doing this, you want to focus on those health problems that is related to wound healing. For instance, you will ask the patient, do you have any history of autoimmune disease? Do you have a history of PAD, peripheral artery disease, or do you have a history of peripheral vascular disease? And do you have a history of diabetes? And if the answer is yes, is your blood sugar under control? When was the last time you had your A1C checked, and what was the number? You want to gather all this information because they will help you to move forward with that patient's wound management. Wound Assessment for Nurses Part 1B. After reviewing the past medical history and the present health condition of the patient, you want to dive straight into medications. Review the medications of that patient, and when you are looking at the medications, focus on those medications that are related to wound healing. For example, you want to see if that patient is currently on taking steroid. Are they on antibiotics? Are they taking any blood thinners? Why antibiotic, blood thinners, or steroid? This is because steroid affects wound healing. Remember that steroid is an anti-inflammatory and it affects wound healing. If you listen to my previous video, I had talked about steroid, how it affects wound healing. Also, if the patient is on a blood thinner, the doctor needs to know, because if they have to do a debridement, they will know not to do any aggressive debridement on this patient because they are at risk for bleeding. Are they currently on antibiotics? You need this information because if you have to collect a culture from that wound, it is contrarily indicated